For years, we were basically relegated to weight loss medications that were amphetamine driven. And everyone's heard of amphetamines, just like illegally used amphetamines. They amp up your system, they make you jittery, all of these things, and they burn energy. And the medical treatment, other than some B12 injections that were used, it was basically the only thing that they had out there for weight loss. And of course, people lost weight because they were on legalized speed. They were on amphetamines. So they're walking around at 10 times the rate, but even then they were still hungry. And the tragic thing is that when they stopped the medication, because of that, they gained it back quickly, and sometimes even more with a vengeance. And there was also a lot of concern about the cardiac effects of amphetamines because the resting heart rate needs to be controlled, and the amphetamines raise that. So there are a lot of risks that came out from those amphetamines. But still, in present day, there have still been the majority of physicians out there in the general public using those amphetamines as a weight loss medication that just doesn't work. Then you go to the starvation diets. Many of us have studied every diet on the planet, the Okinawan diet, the paleo diet, the keto diet, all those things. And granted, we do need to reduce our carbohydrate intake. We need to stabilize our protein intake. Carbohydrates really do cause a lot of weight gain, but this medication stands out. It is so effective in the fact that the patient takes it and they don't feel hungry. The number one thing that causes people to fall off the wagon with weight loss is that they're hungry. You're fighting a natural urge to eat. And then you're ordering a nice big steak at a steakhouse and you have to push it away from you. Not with this medication. You can't out-eat this medication when you order that steak. Now with this medicine, you're going to take 2 bites of that steak and you're going to take the rest of it home for seconds. It modifies your eating habits and your lifestyle, and after a while, these patients learn portion control because they're just not hungry. There's nothing worse than fighting hunger and satiety, right? We've been there. This will limit it. That's what makes it so great. There are people out there who had a gastric bypass surgery 15 years ago, gained the weight back, and they're on this now, and they're losing more weight. It's documented. They've lost more weight on this medicine than they lost from gastric bypass surgery. Now that's incredible.